Dr. Sanghvi now. Dr. Sanghvi, in Maharashtra, we have seen this wave for almost a while now. It's been a month since we've seen an increase in infections. In fact, at least in Mumbai, the numbers have now begun to come down. There were suggestions that were made earlier that perhaps Maharashtra may have reached its peak and, will begin coming down. But that, the Chief Minister just yesterday said that he could now announce a full lockdown. He's still evaluating the situation. So, as far as Maharashtra is concerned, where do you think we stand and how do we bend the curve now?
Good morning. Well, as Maharashtra is concerned, everybody knows that the numbers are maximum in Maharashtra, and there are two reasons for the same. Number one is the tracing and tracking of all the contacts which is being done, and the increased number of RT-PCR tests which are being done. So both these are leading to increased numbers. Well, we are not afraid of the increased numbers. What we need to now do is to see that the situation comes under control. Now this lockdown, or what as our Chief Minister says, the Janta curfew, is not really doing what it was desired to. And we are still getting high numbers to the tune of 60,000 plus per day in the state of Maharashtra. So I fully agree with the Chief Minister that unless and until more strict measures like a complete lockdown, which was imposed last year, as is not done, I don't think we will be able to have a situation which can be handled. At this point of time, we are in a terrible mess. There is a fear mongering, there is a panic situation, because any person who is detected positive is fearing that how is he or she going to get oxygen, how is he or she going to get injection remdesivir. So all these thoughts are there, which are also making them go for early hospitalizations. Result is that the hospitals, either in the public or the private sector, are overwhelmed. There is not a single capacity of bed in the ward or in the ICU or in the jumbo centers. Oxygen deficit remains, and we really do not know how can we tackle such huge numbers. So I strongly adhere to the guidelines which our Honorable Chief Minister has said, and if he proposes for a stricter lockdown, which I or rather the entire medical fraternity does feel is the need of the hour, then only can we bring these increased numbers under control. Because whatever we might say, whatever the leaders of the state or the center say, people are not adhering to COVID guidelines, and we see a complete lack of COVID appropriate behavior.
Right, Dr. Mishra as well.